when you are in a managed care setting, the doctor doesn't need to give you good results.
No.
The doctor will still have his job. That's
right.
You know, and in fact, they love it if you disappeared and they get more turnover. That's right. Whereas the private doctor is a hustler. They want you to come back. So they're going to like bend over backwards, give you results so that your comes back and pay. So they have skin in the game. The doctor wants to deliver results. And they promise you these results. They want to deliver them. They want a good Yelp review from you. They want you to refer their friends. So they have a vested interest in making, an impact. Secondly, like you just mentioned it, Shawn, you were saying that hormones are not like lisinopril when you prescribe them. Well, yeah, because the hormone requires a hormone receptor. And I cannot guess genetically how your makeup and in what tissues and parts of your body are the receptors more distributed than others? I have no idea. We have to give you the hormone and check your and see how you're responding. So I have a man who is, 35 years old. You give him 200 megs of testosterone a week. He became Arnold Schwarzenegger. And then I have men who are in their 40s and they won't feel a thing until you up the dose to 400 megs a week, because they have different receptors.
Everybody's different.
Yeah. Now, of course, if you look at the standards of care, I could be sued. Dr. Abdullah, you're prescribing 400 milligrams a week. That's not the standards of care. Well, these are the standards of managed care, and these are medical legal. And my patient who is safe and satisfied with my results is not going to go to the medical board.
Agree 100%. Let's just clear this. I debate with doctors all the time on this about, getting sued and all this. The number one reason people sue you is because they don't like you.
Right.
So if you are honest with the patient and you take care of them and you make them feel better and you do the right thing and speak truth with them, then the chance of them suing you are very little.
Right. Right.
And that's what's good about having a personal relationship with them.
Right.
And that's the same as we have in our pharmacy. And just talking about, we have skin in the game at our pharmacy because we don't bill insurance. So we bend over backwards for the patients because they are paying our bills, literally. And we understand that. So we make sure that our staff gives good customer service.
Right.
We don't have some insurance network sending us a bunch of patients. We need everyone that comes in.
Right.
So we're going to take care of them well.
Right.